Okay. Well, thank you all very much for joining us here this afternoon. I am being joined by Dr. Gary Antone, who is our Chief Medical Officer for the state of Nebraska. Also, Tim Burke, who is the CEO for Omaha Public Power District, and Jim Macy, who is our Director for the Department of Environment and Energy. We're here today to give an update with regard to our coronavirus and the public health emergency we have here in our state. We've got several announcements. I'm going to talk first. I'm going to turn over to Dr. Antone to talk about testing. Then I'm going to turn it over to Tim Burke, who's going to talk about the steps we're taking at OPPD. And then finally, Jim Macy will talk about our safe water supply. So we've got a number of things that I want to update you on. First of all, I want to remind people that this is something that we need people to take seriously. You've seen that through the steps we've taken here at the state. Recently, obviously, we had our directed health measure for Douglas, Sarpy, Cass, and Washington counties. And that was, again, taking it the next step beyond from what we had already done earlier in the week with regard to the 10-person limits, taking steps such as closing dining at restaurants and bars and that sort of thing. I want to remind people that they need to continue to practice good social distancing. You see it here today, right? We're all kind of standing apart from each other. That we want people to make sure they're practicing good hygiene. So, for example, stay away from anybody who's sick. And when I say sick, what I really want to emphasize as well is that people who have fevers and respiratory illness, coughing, that sort of thing, shortness of breath, that's really the symptoms we're looking for with this coronavirus. Those are the big things. If you have those symptoms, if you have a fever, for example, please stay home. If somebody in your household has that, good advice, and especially if you're in especially if you're in Douglas, Cass, Sarpy, or Washington County, if you're sick, everybody in your household should stay home. And when I say sick, again, I mean upper respiratory, fever, that sort of thing. Everybody in your household in those 4 counties, if somebody in your household has those symptoms, everybody needs to stay home. Okay, so that's one of the things we want people to do. We want people to continue to practice good things such as washing your hands regularly, washing it for 20 seconds at a time, like singing happy birthday twice to make sure that you're spending the appropriate amount of time there to be able to wash your hands and get them thoroughly clean. So continue to do that. We continue to want businesses to continue to make sure they're keeping their people safe, practicing that social distancing. And by the way, folks, we have seen great compliance from people all across this state with regard to the president's announcement about keeping public gatherings to 10 people or less. We saw that on St. Patrick's Day. We continue to see that. By and large, Nebraskans are doing the right thing. They're stepping up to meet this challenge. They're practicing social distancing. Restaurants are providing carry-out or delivery or drive-through. They're not doing dine-in the Omaha area. Those are all key things that we want people to continue to practice all across this state to be able to limit the spread of this virus and make sure we protect the most vulnerable people in our state. We must do this, and Nebraskans have been doing it. And I appreciate everybody's sacrifice in doing this along the way, so thank you. We also want to make note that for those folks who are in schools that are operating without students, the Education Commissioner has asked me to remind people that you should not bring, if you're coming into those schools to work as a parent, do not bring your kids. We want you to find other arrangements for your kids. Then again, we're really trying to limit that number of people in buildings. We want to limit social distancing, or we want to expand social distancing. So if you are working in one of those schools, do not take your kids to that school. The Commissioner of Education has asked me to remind people. We have, as of this afternoon, 33 confirmed cases of coronavirus here in the state of Nebraska, including one that was just identified here in the city of Lincoln, which is the first case in the city of Lincoln. My understanding is it's a travel-related case. The mayor of Lincoln will be making an announcement with more details with regard to that at her press conference at 2:45 this afternoon. So that is all I'm going to share with regard to that. But again, we're at 33 confirmed cases in Nebraska. That also includes a community spread case in Sarpy County. Now, we've already issued a directive health measure for Douglas, Sarpy, Cass, and Washington County. So this will not change that, but it is worthy of note that we have another community spread case. And again, that's a case where we do not know how that person got it. So that's an update with regard to Sarpy County. And then finally, one of the things I wanted to bring everybody up to date on was that we are working with the legislature on an emergency package, an emergency appropriation. I've spoken with Speaker Scheer and Senator Stinner, who's the chairman of the Appropriations Committee, about requesting $58.6 million from the state's cash reserve fund to be transferred into the governor's emergency fund for us to be able to use to fight the spread of the virus here in our state. That $58 million would be broken down to roughly $38 million for us to be able to do things like buy more personal protective equipment and be able to distribute that to our firefighters and EMTs across the state, especially those, I know our volunteer fire departments and EMTs are concerned about that, to our local public health groups, public health departments. We want to be able to expand that testing. These are all things that we are looking for additional appropriations to make sure we've got the resources necessary to be able to go out and make these purchases and get them distributed, make sure we can help our local public health departments staff up if they need to. That's the kind of appropriation to have a direct intervention, again, in fighting the spread of the coronavirus. We're also looking for about $4 million for our Department of Health and Human Services to be able to staff up on our own to help fight the virus in things like the epidemiology team. Again, making sure that we've got the staff to be able to respond to the things we need to do in the Department of Health and Human Services with regard to specifically fighting the coronavirus. We're also looking for about $13 million for staffing in our care facilities, like our 24-hour care facilities at the Department of Health and Human Services, what we're doing to take care of our veterans and our veterans' homes for the Department of Veterans Affairs. So we expect that there may be surge staffing required, especially paying overtime if we have some of our teammates who may need to stay at home because of child care issues or if they're quarantining. So we want additional money to be able to make sure that we can have the resources to be able to take care of the people that we need to here in the state of Nebraska that we're directly responsible for. Also, a part of this appropriation is about $3.5 million that we are requesting on behalf of the University of Nebraska Medical Center. And that, again, is for their needs to be able to expand the type of testing they can do, expand their software, sharing information, all the sorts of things that will allow UNMC to be able to do a better job in helping directly fight the coronavirus. So if you put all these things together, it comes out to about $58.6 million. And again, what we're requesting is money directly from the cash reserve be transferred into the Governor's Emergency Fund. The advantage of going to the Governor's Emergency Fund is that it'll be very transparent about how this money is being used specifically with regard to fighting the coronavirus. It will not get mixed up with our other regular operations that we have, for example, the Department of Health and Human Services or Veterans Affairs or anything like that. So this will allow us to keep those dollars specifically separated so we'll know that we're spending these dollars on fighting the coronavirus. And should we not need to spend all those dollars, that will make it also easy to transfer them back into the cash reserve. So again, we can keep these dollars segregated, know exactly what we're spending on, be very transparent how those dollars are being spent, and should we not need all those dollars, then we can transfer them back into the cash reserve, and again, make that process all very transparent. I will be having a phone call later this afternoon with our state senators to be able to brief them on that, and then we will work with the legislature as well on an opportunity to be able to reconvene specifically around getting this appropriation so that we can continue to fight the coronavirus here in our state. So with that, I'm going to turn it over now to Gary Antone, who's going to talk about our testing procedures. Then we'll go to Tim Burke, then Jim Macy, then it will come back to me for questions and answers. And as I've done in the past, I will take the written questions that we were given first, answer those, and then we'll take questions from the press. So with that, Dr. Antone.
Thank you, Governor. As the Governor mentioned, we now have 33 confirmed cases in the state of Nebraska. This is out of a total number of close to 800 tests that have been performed now in the state, including through the Nebraska Public Health Lab, the University of Nebraska Medical Center Lab, and the commercial labs. If you do a percent basis, that's less than 5% of the cases that we have tested have confirmed positive. And these are the types of patients that we're testing that are very, very high risk for testing positive. So just to reassure people that even though we're testing the highest risk patients, the percentage is still rather low. However, because of the limited number of tests that could be performed in the state of Nebraska, we limited it to these patients that were high risk, such as patients that were hospitalized for pneumonia but didn't have a diagnosis of why, or patients that traveled from high community spread areas such as Asia or Europe, or from some of the areas here domestically and had the symptoms, or close contacts with those people. And the reason for doing the testing on these high-risk patients was so that we could use our epidemiology teams at the local public health departments to help contain their close contacts and keep the spread from happening, to so-called flatten the curve, or to keep Nebraska flat. The other types of patient...
Did you just make that up just now, Dr. Antone?
It's,
flat, really?
it's on the webpage. I'm almost certain. Or at least I heard that. I like it anyway, whatever. Keep Nebraska flat. Isn't that what Nebraska means, is flat?
Not flat. You ever been to the city?
Okay, all right. You're throwing me off here, Governor. We want to expand testing. And everybody hears about why we can't expand testing. And one of the reasons is because we had a limited supply of testing kits. So everybody talks about these kits. So there's three parts we divide up these testing kits into. The first is the obvious swab and the solution or the media, the viral media that you put the swab into to then send to the lab. And we had some limited supplies of those at first. We are guaranteeing we're getting more supplies for those, so that if you need a test and as we expand testing, those will be available. The second and third parts of these testing kits includes taking some of the material that's been put into that viral media and extracting the nucleic acid or the RNA from the virus so that it can be tested in a polymerase chain reaction PCR machine. And that takes a reagent to do the extraction and a reagent to actually do the test in the PCR machine. And those are still in short supply, but more are coming out. And as more come out, that's why we'll be able to expand testing. We at our public health lab have the capability of doing approximately 100 tests per day now with the reagents and the materials they have. And the University of Nebraska Medical Center has their own lab test that they can also do about 100 tests a day. And we are expanding, sending tests out to the commercial labs like Quest Diagnostics and LabCorp. And we're getting results back now from those commercial labs. We're going to expand testing as we become more and more able to get those tests done. We hope through the Nebraska Public Health Lab that soon we'll be able to expand that number from 100 to 400 or even 500 here very soon per day. We're also counting on and hoping that soon our own hospitals in the metropolitan area or throughout the state will be able to develop their own test. And that way we'll increase testing capability. And why would we want to increase testing capability? Well, we want to make sure that the people that are critical to get tested will get tested. And those include healthcare workers. We have to make sure we keep our healthcare workers able to work. And so they'll be priority items to get tested if they develop symptoms. Same for first responders. And then our long-term care, our nursing care facility patients will also be on that list. So very soon we'll be able to expand that to that role. And I hope I was able to explain what these test kits were today, and I'll be happy to answer any questions later. So thank you, Governor.
Thank you, Dr. Antone. Did you notice how he threw around some of those fancy terms, like, what would you say, nucleotide something, polychromase, whatever?
Governor was a biology major. He knows what I'm talking about.
Next, I'd like to turn it over to Tim Burke, who's going to talk about the efforts at OPPD with regard to this public health emergency. Tim?
Great, thank you, Governor. Just as the doctor spoke about, when we think about utility organizations where we generate electricity, we distribute it, we transmit it, we provide those critical restoration services, we also consider ourselves part of those first responders. Because what's really important on the electric side of the business, which I'll talk about some of the actions that each of the utilities kind of have taken over the period of the last several weeks, it's about keeping those critical, essential operators at the power plant, operators on our systems, and our line technicians that provide exceptional service to our customer owners healthy and well and able to continue to do their related work, so electric service is not impacted. And I will just assure you that public power in Nebraska is alive and well, and we're committed to maintain and to continually serve the customer owners across the state. I will talk about the things that we're doing nationally, regionally, and then locally, and then some of the initiatives that many utilities have undertaken over the last several weeks. Nationally, we have folks within the state of Nebraska utilities that are actively engaged with the Department of Energy and the Department of Homeland Security on a daily basis, just to make sure that they're evaluating, understanding current conditions, but also looking at longer-term issues or concerns across the electric grid across the United States. Kevin Wales is a great example of that. He's the president and CEO of LES, and he is on that Electric Coordinating Council as a representative of public power for the nation. So it's a great resource right here in Nebraska. Another example of what we're doing is that 26 utilities, the largest utilities across the United States, got together in a conference call that we are having weekly to talk about best practices. It's an opportunity for us to really identify what the folks in New York are doing, what the folks in California are doing, and some of the other critical states, such as the state of Washington, and how they're responding to the crisis occurring in those states. And so we're taking those best practices so we can begin to educate ourselves and begin to implement those. Locally, across the state of Nebraska, I've had the opportunity to engage with about 5 or 6 different CEO and general managers, and we're all looking at how we implement our pandemic or our crisis planning. I'll give the example of OPPD, but I don't think it's any different than any of the other utilities. We are all staging ourselves in different levels of our pandemic crisis plan or our infectious disease plan or our business continuity plan, whatever it may be called. But as an example, over the last several weeks, we have sent people home to work from home, really to distance themselves from those critical operating and essential employees that need to make sure they operate the power plants, the distribution transmission systems, and they're able to dispatch our power across this region. That's pretty important for us. We're using the guidelines that the Dear Doctor and others nationally and locally and regionally have provided us around safe distances to make sure that we operate in that regard. Now, we're continuing to do our work in Omaha. We're continuing to have our line technicians do construction. They're out in the open environments. We're really focused on social distancing inside our facilities and monitoring each employee, and they are self-monitoring themselves. Our power plants are still going through many of their operational and maintenance-related work. We think that's really important for us to maintain strong reliability across this region, and we'll continue to do that. We are, I will tell you, prepping for potentially shelter in place. Depending on the status of the crisis, we would shelter employees in place in those emergency essential areas where they will live, sleep, and eat for periods of time to make sure we can maintain a strong and operational system. And that's been a public power commitment for years, and we're going to continue that. The utilities also most recently just re-engaged around our mutual aid. So if there are storms in Lincoln or O'Neill or Grand Island or Columbus or Sandhills of Nebraska, utilities get together and they help each other. And so we just resounded our commitment to be able to do that. And that's just a strong sign of public power across the state of Nebraska. Some of the things that we're doing with customers in Omaha is that we did extend our disconnection period through April 30th. But my guess we will be expanding that and extending that for longer periods of time as we work through the resolution and the transition of our current crisis. We're looking at a variety of other kinds of customer options and solutions that we might be able to put forward over the course of the next month or so. We also closed our customer service office One, because we're jointly in an office with Metropolitan Utilities District, another great utility provider of water and natural gas. And we wanted to make sure that those employees were safe, but also as public gather in those areas to pay bills or to look at payment arrangements, we had to shut down that office or close that office for a period of time for the safety of our employees, but also for the safety of the public. But we're committed to make sure that those customers have a variety of alternatives to pay, but also for us to really think about how we serve those customers that are struggling the most as they go through this process. So we'll continue to maintain that public power commitment of affordability, reliability, and environmental sensitivity. And I will tell you on behalf of the Nebraska Power Association, folks are doing some great work across the state. So thank you very much. Thank you, Governor.
Great. Thank you very much, Tim. I appreciate all the work that you're doing. And just on that topic as well, I believe LES is also not going to be cutting people off because of non-payment during our public health emergency here. And now I'd like to turn it over to Jim Macy, who is our Director for Environment and Energy for the state of Nebraska, and he's going to talk about water.
Thank you, Governor. Well, good afternoon. I just want to make an announcement that our drinking water treatment plants provide clean and safe and abundant water supply for our Nebraska communities and citizens. Our drinking water remains safe to use. There's no indication that water can carry the COVID-19, and it's not been detected in any drinking water supplies. Our state has an abundant clean groundwater supply, which community systems test regularly. The community water systems are responsible for testing their wells to ensure good water quality. Drinking water from the tap is safe for public consumption. Oftentimes, though, it's easier and more convenient to have some bottled water around, and we support that idea. It's easier than sanitizing glasses after you use those. But we want to assure you that your drinking water supply is safe. We have an abundant supply, and we encourage Nebraskans to use their tap water. Thank you.
Great. Thank you very much, Jim. Another issue that I want to make an announcement on is that Nebraska had applied to the Small Business Administration for disaster declaration, which will allow small businesses and nonprofit organizations in the state to be able to apply for loans. We just found out that Nebraska has been approved of for this disaster declaration, and we will have more information forthcoming with regard to how to apply for that. But if people are interested, they can go to www.sba.gov/disaster, and there's the information with regard to how businesses can apply for these loans. I think my understanding is you can apply up to $2 million. They can be up to 30-year loans. The interest rate is roughly 3.75% for business, 2.75% for nonprofits. And we will be working on setting up a call center at the Department of Economic Development to help companies be able, organizations be able to help apply for that. There'll be more information on that as we go along. And then finally, also want to make the announcement that we will start doing daily press conferences like this. We will continue to use 2 o'clock in the afternoon as the time for that. And so again, we will just plan on being here every day, I should say daily, but it's going to be every weekday. Weekday here at 2 o'clock. And now what I'd like to do is go into the Q&A portion of our press conference here. And as we've done in the past, we'll start with, again, I appreciate people who are social distancing and sending in their email questions. The first questions are coming from Grant Schulte of the Associated Press. Can I outline the budget requests that I've gotten, which departments have made requests, and how much are they seeking and purposes they're needing money? I kind of covered that at the beginning. And again, I want to be clear that we are specifically requesting dollars to fight the COVID-19 virus. So this is about fighting the spread of the virus here in our state. So we work together with our agencies to be able to come up with the appropriation request that we're going to be briefing the senators on later this afternoon. And that is how we came up with the dollars that I broke out for you earlier. I talked about if their proposed source of funding is from the cash reserve and going into the general's emergency fund. Do I anticipate additional virus-related funding needs that aren't yet known? Well, that's kind of a loaded question. If they aren't yet known, I'm not sure how I'm supposed to anticipate them, but certainly we will continue to evaluate the situation as it continues to develop. And then there's a question, will the Nebraska Department of Revenue be postponing the state tax filing deadline given Secretary Mnuchin's announcement today? we are reviewing that, and we'll have a decision and announcement on that next week. And that's the same question I got from Don Walton in the Journal Star. Will the state extend its income tax? And again, we're reviewing that right now, and we'll make a decision and an announcement next week. From Aaron Grace at the Omaha World Herald, there are some tenants groups and anti-poverty groups wondering who has the power in the state or local government to curtail evictions, if anybody has that power, and does the governor have that ability? I will tell you right now, this is something that we are reviewing right now. It is certainly my expectation that in a time of public health emergency, that landlords would not be evicting tenants when we are going through so much economic disruption. So with regard to the specific question, we're doing the research on that right now. But again, my expectation is that landlords will not be evicting tenants, just the same way that public power is not cutting people off from their utility bills. Look, folks, we've got to help our neighbors out here. We're all going through a lot of tough times. There's a lot of uncertainty, there's a lot of disruption. So do the right thing. Use common sense, good judgment. Do the right thing. We've seen that. By and large, Nebraskans are doing the right thing. They're stepping up to meet this challenge. That's what I would expect our landlords to do. On that note, you may have seen that the federal government has also said that homeowners who have federally backed mortgages will be able to get extensions on their mortgages by contacting their bank. They need to contact their bank, but they can get extensions on their mortgages. From Chris Burback at the Omaha World Herald. Talking specifically about the executive order I signed yesterday with regard to liquor stores being able to sell package out of their store, waiving some regulations on that. Any concern about leading to more drinking and driving open container violations? So again, what liquor stores will have to do is they will have to comply with all open container laws that are currently on the books, and they will only be able to sell alcohol that is in the original package. So that's what current law is. That's what they will have to do. With regard to additional drinking and driving, again, I expect Nebraskans to do the right thing. Be responsible. If you're buying packaged liquor to take out, take it home. In fact, I will note that I read the article in the World Herald today that the State Patrol had the fewest number of arrests for DUI on a St. Patrick's Day than they've had in 15 years. So with that, I'd like to go ahead and open up to questions and answers. So for the folks that are here, if you've got questions, we've got our speakers here. If you have a specific question addressed to one of these folks, just let that person know so they can come to the microphone. Yeah.
My question is for you, Dr. Anton. So we talk a lot about the capacity that the state has to test per day, 100, 200. How many physical tests do we have in Nebraska right now?
Physical tests mean having the active reagents that we need. The swab should be no problems. The viral media should be no problems. It's the number of tests that we can run based off this reagent process and the time that it takes these tests to be run. So right now, the Nebraska Public Health Lab is doing 100 per day, but we hope they'll be able to expand very soon to maybe even up to 400 or 500 per day in a certain process they're developing right now. The University of Nebraska has a similar type setup for 100 per day. And then if providers want to or hospitals want to, they can send out to the 2 commercial labs that are accepting specimens now. And that, according to what we hear, can be unlimited, but I know it's going to be under what they're saying. You know, they're saying maybe 1 million a week, but we're not certain that that's a true number right now. But it's going to definitely be expanded. And the reason for doing that is to make sure we can get our healthcare workers, our first responders, and to protect our nursing home patients and therefore the healthcare workers from fighting the spread. Again, our local public health labs have done such a great job. Look, 34 cases in 2 weeks or 3 weeks is amazing. So that's all due to their work, doing their contact investigations and keeping people isolated and at home.
If I could just tag on top to that testing question. One of the things when we had our call with the president yesterday was with regard to what they're calling Roche tests. Again, a different company, there's a different machine. So part of what's going on, as Dr. Anton described, is kind of the process that the CDC and the FDA had approved originally, and that's what he's talking about. But other hospitals can develop their own. Yesterday, the CDC said states are free to be able to work with their providers to develop their own tests. And then there's the tests that the federal government is going to be distributing, these what they call Roche tests. So they are going to be distributed through the Federal Emergency Management Agency. We have been in contact with our Region 7 to put an order in to be able to get those tests. So we're working on getting an expansion that way. So there's a variety of ways that we're getting to expand. So you can't say specifically how much capability we have because it is limited by the reagents for our current tests, other hospitals developing their own tests, being able to do it through FEMA and the Roche test. So there's going to be a variety of different ways that we do that. And as we expand the different types of way we can test, that will also really mitigate the issues around being so tied to certain types of reagents that may be in limited supply. Is there a question back there?
This might be another question for Dr. Antone. I mean, realistically, for the state, are we behind on testing? Because you're seeing other states that have drive-through testing, they're testing in mass numbers, and people are getting turned away from testing if you're not in kind of a high priority group. So
One of the reasons we didn't jump on to this drive-through testing is because of our limiting testing capability that we have in the state. But I don't think we're behind on testing. I mean, we want to know what the real prevalence is out there in the community, and that's another reason to start expanding testing. But even knowing that, look at our incidence. I mean, it's like less than 5%, even in the highest risk population. So, I mean, no doubt we want to expand testing. We want to get people back to work, especially the healthcare workers. We want to keep the nursing home population healthy or get them out when needed to. So that's the reason. So I don't think we're behind, so to speak. And like the governor said, these reagents, they're being distributed based off what they're seeing throughout domestically. So it would be only fair for a state like New York or the area of New York City or California or Washington to be getting a higher proportion of these test kits. But we will get our proportion.
This is another question for you, sorry, here. I was going to say, for someone that's in the healthcare or the industry, what do you say to those physicians, those family practitioners all across the state are turning people away, that they see these symptoms in these individuals that check all the boxes, but they're saying, you know, we don't have the kits for you, please go self-isolate for 2 weeks without knowing where that individual is going? I mean, what do you tell those doctors and physicians that are having to make those decisions?
First of all, we are totally relying on those doctors, and I commend those doctors that are doing the testing right now. But as far as what you just mentioned, what they're saying, telling their patients is the exact right thing to do. If you have the symptoms, just go home. If you're sick, stay at home. Quarantine yourself for 14 days. That is almost proven to be as good as a vaccine. Obviously, it's very disrupting, but that's what we're doing right now. But that's what we don't want to have happen to healthcare workers or first responders. We want to get them back into the workforce as quick as possible.
Doctor, it sounds to me as if you're not talking about a situation where people who, in that situation, as he just described, where they would be able to get tests. You're talking about prioritizing these healthcare workers, et cetera, but not a situation where there would be tests available for the general population.
Yeah, obviously we would ask them to go ahead and do an influenza test, which they can do in their office. And that, if that turns out positive, then we have our answer and there's no need to go any further. But you're right, we have to prioritize at this point, but we will get to the point where we'll be able to test those patients. We'll be getting the protective equipment for those healthcare providers, and the testing will become available for those patients.
Governor, I thought the last briefing we had, you said
Excuse me, Gary.
that we had already increased the capacity up to 400 or 500. Was that premature or did I misunderstand?
No, I think, well, that was my understanding of where we were going to be, is that we were going to be up to 400, but we needed to get CDC and FDA approval on that. I think with what we're now trying to seek clarification is with the announcement the FDA and CDC made yesterday, we may not need to get that. So we're working trying to get those answers, and frankly, it's part of just there's an overwhelming amount of requests going into Washington, D.C. right now. But as soon as we get that, we will be doing what Dr. Antone said with regard to expanding the capacity within our current testing. I am pushing very, very hard to get that as soon as possible. So, I mean, Fred, I think you kind of know my tolerance for bureaucracy is 0. So I'm really pushing to kind of get the answer on this. And then I just also want to piggyback on Dr. Antone's questions with regard to doctors. You know, if somebody has the symptoms that we're talking about, again, I want to emphasize this is fever, respiratory symptoms like cough, that sort of thing, and they contact their physician, the physician should take the appropriate steps, right? You know, for example, make sure that they've got another entrance for that person to come in, keep them in a different rooms, they're not in contact with other patients or other people in that clinic, make sure they're donning protective equipment, you know, the face masks, the gowns, the gloves, and as Dr. Antone said, do the test first on influenza, influenza A, influenza B, do the respiratory panel, because that is still way more prevalent in our state right now than coronavirus. So if you get those positive tests on those things, then you can be fairly sure the person doesn't have coronavirus. They still need to go home and stay at home till they're better, but that's the steps that doctors should be taking with regard to patients who call them and you know, have these sorts of symptoms. Yeah,
33, 34, sorry, I didn't.
it's 33.
33. Isn't that a little bit unrepresentative of the total number, knowing that we are turning people to go away that aren't getting tested throughout the general public?
So is your question, do we think we have more than 33 people in our state with coronavirus? Is that what you're asking?
Yes, because they can't be tested.
The answer to that is yes. We do think we have more than 33 people. Sorry, Fred. No, I just did your thing here. So we do think we have more than 33 people in our state that have coronavirus. As Dr. Antone was indicating, we're prioritizing the people who are most at risk, right? We go through that process I just described of testing for flu and respiratory. And then if you are somebody, for example, who has traveled overseas to Europe or Asia, has been to one of the hot spots like New York or California or Seattle, then you're at higher risk. That puts you up at a higher priority to be able to get the test. Whether you can get the test or not, you still have to go home, right? You still have to go home and take care of yourself if you're having these symptoms. We're telling everybody who has those symptoms to go home. What Dr. Antone is talking about is as we have the facility to be able to do more testing, we're going to prioritize other groups like healthcare workers, first responders, people in our nursing homes, so that, for example, healthcare workers don't have to stay at home for 14 days. They can go back to work if we know, even though they have these symptoms, they didn't actually have coronavirus. That's what this is about. So yes, there are people who have coronavirus that we don't know because we haven't tested them, but if they're symptomatic, they need to be staying home, just like if you had the flu, you should be staying home. Yeah.
We have a couple of follow-up questions.
Couple of follow-up, go ahead.
Yeah, David Earl from KTV, and we'd like you to repeat this question to the mic so people can hear it, is can we come out on the other side of the shutdown with the capacity to test everyone anywhere? Anyone that we're
So the question was, will we come out on the other side of this with the capacity to test anyone, anywhere? I expect that the testing capacity will grow dramatically. America has always stepped up to the challenge to be able to do things. If you go back to World War II and the ability to produce Liberty ships and turn those out in a matter of days was really part of what led to the United States winning World War II, was our production capacity. I do expect that this production capacity will increase. We will always probably want to screen people because flu is still way more prevalent in our society than anything else. But we do want to get to the capability of having people be able to get the test on a broad basis so that they can be confident that they're testing negative for the virus and feel confident when they go out in public and do some other things. So I do expect that to happen, but it's going to take time for that production capacity to ramp up. Yeah.
So what would you say to the general public who are going to these hospitals and asking for tests and not getting them? You say, go home, isolate, but I mean, you gotta understand it's gotta be a little frustrating for them that they're not getting tested for something that they probably have, they just have to assume that they have it.
So the question was, it's frustrating for somebody who, say, develops these symptoms, has a fever, has the upper respiratory symptoms like a cough, to not be able to get tested to determine whether or not they got the flu or they have the coronavirus, and I certainly understand that. I think the message I would send to the public is the flu is still way more prevalent. Whether you have the flu or coronavirus, if you have these symptoms, you need to be staying at home. And during this public health emergency, if you have those symptoms, stay home for 14 days plus 72 hours after those symptoms end. So we want people to make sure they're safe, they're home, they're getting better. When the symptoms end, 72 hours later, plus the 14 days plus 72 hours, that's when you can return to work.
Those 33 cases, is that including this one in Lincoln?
So yeah, so that includes the person here in Lincoln. The 33 cases include the person in Lincoln.
And then this, the time frame for this money that's being requested, is there?
With regard to the appropriations that I'm going to be briefing the senators about this afternoon, we'll work with the legislature to be able to find a time for them, assuming they're willing to move forward on this, to be able to come back in session, to be able to get this done, and then they would, again, I would leave it up to Speaker Scheer on how he wants to handle it going forward. But this will be the priority to get done. I would love to have this get done next week sometime, but you know, it's really the Speaker's discretion on how he wants to manage his body. Here, I'm going to go over to Martha, then I'll come back over here.
Governor, are you thinking that we may need to revisit the revenue forecast for the state? There's been some suggestion that the forecasting board should come back in and take a look at that because of what's transpired since they met.
So the question was about, are we looking at the revenue forecast? Does the forecasting board need to come back in? I think at this time it would be premature to have the forecasting board meet because they actually need data to be able to make a determination, and we don't really have any data with regard to what's going to happen to the economy. We certainly know that this is going to have a financial impact to the economy, right? We can see that all around us. That implies that it's going to have an impact on our state revenues as well. At this point, though, we don't know what those impacts are going to be, but I can tell you that my team and I will be managing this very closely. We will continue to work closely with the legislature, the Financial Forecasting Board, when they feel they've got the information to be able to make a new forecast. They may want to come back in session, come back and meet with regard to that. But we're going to be looking at our own forecasts as well. I've already sent the message to all my cabinet members that they're going to have to start looking at controlling spending because this is almost certainly going to have an impact on our revenues, and therefore we're going to have to take steps to make sure that we're controlling those expenses in light of the fact that we expect there to be a revenue downturn. Yeah.
This will probably be for Dr. Antone. If you were going to be able to put your finger on a magic number of this is how many tests we need every single day, day to day, to not turn anyone away, what would that number be?
And here in Nebraska, I would say maybe 100,000 people, maybe 50,000, maybe 25,000. You have to ask yourself, the test itself isn't going to protect you from getting any less ill. You're still going to have to go through that 14-day plus 72-hour quarantine. So at a certain point, you have to ask yourself, why do we even test anymore? If you have the symptoms, then maybe you should just stay at home and then get better and then stay 72 hours more after your 14-day quarantine, and then you'll be fine. And over 80% of the people will get through it that way. The real reason for testing is to keep people in the workforce, especially the people that need to be in the workforce, which are the people that are going to take care of the people that are going to get ill. And that's really the purpose at this point.
So if you have those symptoms but you test negative, you could keep on working?
You can. If you're sick and you have those symptoms, you should stay home until you feel well again.
So what's the point of testing?
That's what I mean. The whole point of testing is to make sure if you have those symptoms and you test negative, you're okay to work after you get over those symptoms. You don't have to maintain that 14-day quarantine.
So if you test after the symptoms?
We have a question from Jeff with New Shingle, Nebraska. He wants to know.
Who's it directed to, Taylor?
Dr. Antone or you, Governor. Does the 33 cases include the people from out of state? And are there any non-Nebraskans still in the hospital in Omaha?
I can answer that, Governor. Currently, there's only one person from the original, we have nobody here in the hospital from any of the repatriation efforts, including the Diamond Princess or Grand Princess. We have at least one person still at University of Nebraska, our original index case, that's still in critical condition, but according to the reports, getting better, which is great. Myself being a surgeon, I know that every day a patient's on a ventilator and gets to the next day is a victory. And so far, it's been a victory for this patient, and every day is another victory. And according to reports, she is getting better. And the follow-up on that, Taylor, was what, as far as?
You answered both of them, but we also have a question from Alexandra with KTV. She wants to understand that we can process a certain number of tests each day, but why aren't we reaching our maximum number daily?
Because of our guidelines. Our guidelines are saying that you have to meet those criteria that I said earlier, whether you're somebody ill in the hospital with the pneumonia that there's no diagnosis for, whether you've had a close contact with a positive tested patient. And as a matter of fact, of those 33 cases we have, almost a third of those cases are from one contact. So that tells you how good of a job the local public health departments are of keeping people isolated like that. And then, you know, obviously if you travel to a high-risk community spread area, like we've mentioned, and we're considering some of those domestic areas now as high-risk spread areas.
My question's for the governor. So, you know, you're asking people to stay at home for 14 days, self-isolate. For the people who finances are a concern to stay at home for 14 days, or just people in general whose livelihoods may have been affected by this, they're scared, they don't know what's going to happen in the future. Do you have a message to those people?
Sure. So obviously, we're going to get through this like we get through it always as Nebraskans. We'll do it together. And for those folks who are being financially impacted, maybe you've been laid off, or maybe you have to stay at home, we're working to be able to make it easier for things like we're waiving the work requirements around the SNAP program and the Aid to Dependent Children program. We've waived the work requirements for unemployment. We've waived the waiting week, the week that you usually have to wait to get unemployment. So all those things to be able to make those resources available faster. And of course, the federal government is working to provide aid as well. So we know that this is going to be a tough time for a lot of families here in Nebraska. And both the state and federal level, we're working to be able to try and soften that blow that people are going to receive economically because of the coronavirus. Yeah.
Governor, is there any chance of flights out of Nebraska being canceled due to the spread of COVID-19?
The question was, are there any chance of flights being canceled out of the state of Nebraska because of the coronavirus? And that would be up to the individual airlines. I suppose then the administration at Eppley Airfield, they would have their own criteria, but at the state of Nebraska, we have no plans to put businesses out of business, to shut down business, to prevent flights. Again, we want people to be healthy and safe, and that means take appropriate protection and steps to be able to do that, but people can still go to work.
With you saying, you know, you think that there are more people who have COVID-19 than just the 33 confirmed cases, do you think we need to reevaluate the 10-person group limit, or do we need to make any changes to social gatherings?
No, what we have done with regard to the 10-person social gatherings is really part of the plan that we developed with the experts at UNMC several weeks ago. It's all kind of blurring together right now, I gotta tell you, I don't remember exactly when, but we planned this out way before we actually hit this point. And that really is what we determined was the steps we needed to take given the information we have. It's what the president recommended on Monday. This was part of our plan to get there when we had those community spread cases, which is really what it gets about, is that community spread case, the case that you can't track, that you don't know where it came from. And so we have really, with our directed health measure, gone to the point where we are with community spread in those 4 counties I mentioned earlier. And if we have community spread, that case we can't track in other communities, that's when we'll take the same directed health measure to be more restrictive in those areas, just like we're being in Douglas, Sarpy, Cass, and Lancaster Washington counties. Yeah.
So on that kind of same track, if we were to have more community spread cases, our numbers spike, do you see us doing something similar that California's doing right now, with a statewide stay-at-home order?
I do not foresee us doing something what they're doing in California. They've got different circumstances. I'm not familiar with the facts on the ground in California. They're obviously much more urbanized, but I do not see us doing anything like what California's doing.
Do you have any estimates of how many more cases there may be out here than the 33 that have been identified by testing? And then also, how can community spread cases be identified unless they happen to be that minority of cases who are severe?
Right, so as we are able to expand testing, we'll know more with regard to those community spread cases. We'll probably identify more of those. As we do more testing, we know that the number of cases will go up because we're going to be testing more people. So with regard to those cases in the community and how it spreads, what it indicates is that we are somewhere between 0 and 1% of the folks, you know, going up, and that's how we were using that general rule of thumb of, so for example, 2 cases in Omaha as a case we would start doing the most restrictive measures that we've put in place. So I can't tell you, we don't have a model, we don't have an estimate. Nobody knows exactly how many people in the Omaha area have the coronavirus. We know it's more than the 33, but we don't know how many more. But we have already taken the steps to be the most restrictive we were planning on being, given we have those 2 community cases long before we reach the point where we're getting to that 1% level of the people having it.
Governor, we have a question from Mike with WWT. He wants to know, people are asking why the malls are still allowed to be open.
So the question from WWT-TV was, why are the malls still being allowed to be open? And again, we're not looking to shut businesses down. We're looking for them to take the appropriate steps to limit public access to about 10 people. And we expect malls to do the same thing, and that's what we're seeing. If you go to a mall right now, you're not going to find 10 people clumping together or more than 10 people clumping together in any one space. I have been in contact with the mayor of Omaha with regard to this. I've asked her that if she does see that this is being a problem, she should let me know. However, her response back was the police have been checking on compliance with the 10-person rule over the last several days, and they have not found that to be the case with regard to our malls. So until we see that that becomes a problem, we're not going to put more restrictions on it. Yeah.
Are we keeping track of the number of people who are testing negative for influenza, upper respiratory issues, but aren't getting tested for COVID-19 and getting sent home? Could we include those in our case numbers for Nebraska?
Well, we do track the number of people who have those influenza-like symptoms, and that's part of how we are tracking how we think the virus, any virus is spreading. It does take time to compile that information, so it's not as quick as, say, when we get a test back in our public health lab. There's actually a week's delay or a week delay or more, somewhere between a week and more delay as we collect that. But that's actually one of the tools that we look at, which is, how many people are getting tested, how many people are actually coming back with the influenza test being positive. And so if we were to see the number of people in our community dipping with influenza, yet the number of symptoms going up, that would be one indication that we've actually got something else going on, like the spread of coronavirus. My understanding, and Dr. Antone, correct me, we have not seen that yet. So that's part of what our public health departments do, is track that. They were tracking that before the coronavirus. It's one of the things that we do just in general as far as our public health mission, is to track that sort of thing. Whether those tests are publicly available, I'd have to defer to you about that information and how readily available it is.
I just know it has not happened yet.
Yeah, it hasn't happened yet.
We just have about 2 more questions.
2 more questions. Yeah.
In regards to a little bit of foresight here, say 2 months ago, right? Were these tests ever available in terms of, had something like this happened, were they ever available, or was it something that was engineered for the coronavirus? And if it wasn't engineered and they were available, was there preparation for an idea of something like this happening?
Well, okay, I'm going to step out on a limb here, and Dr. Antone, you step in if I get it wrong. So the coronavirus is a new virus. We've never had any experience with them before. Now, we do have a coronavirus family, things that cause the common summer cold, for example. But as this is a new organism, a test had to be developed specifically around the DNA for, and as the doctor's going to correct me, RNA, because that's what we're really testing for. It's a different type of nucleic acid within the cell. But anyway, it's a different thing within the virus itself that you're testing for, unique to this virus, to be able to determine that it's coronavirus and not flu. Is that accurate, doctor?
That's correct, and it's specific for the genetic sequence for that RNA.
So specific to even down to that genetic sequence for that organism. So there was no pre-existing test for this. And so that's why the tests have to be developed and ramped up. And I think it's also important to bear in mind, because some people have asked me questions, why is this different from some of the other viruses we've seen? We've seen swine flu, avian flu, H1N1. You may recall, some of you were probably not old enough, when the swine flu was out, that was supposed to be a big deal. It never materialized. H1N1 was not nearly as virulent as this is. So every virus has its own profile, and there really is no predicting what that profile will be until you actually start experiencing it. And that's why, again, it takes time to develop these tests and then build them up over time, build up capacity to be able to test for it, because each one is unique. Last question. Nobody wants to be last question? All right. Well, again, I want to thank our guests today, obviously Dr. Antone, who's our Chief Medical Officer, Tim Burke, CEO of OPPD, and Jim Macy, who is the Director for the Department of Environment and Energy. As I said, we will continue to keep you updated. We're going to be moving to daily press conferences at 2 o'clock to keep you updated on all the developments that we have here and what we're doing at the state of Nebraska to fight the spread of this virus. Again, I want to thank all Nebraskans for their sacrifices. We know this is going to be a tough economic time for everybody. We know this is going to cause a lot of heartache. We are working to alleviate that, and we are working very hard to prevent the spread of this virus. But what we have seen is Nebraskans are stepping up. The Nebraskans are working together. The Nebraskans are protecting the most vulnerable people in our state, and that we will all get through this together just like Nebraskans always do. Thank you very much.